Schizophrenia is a psychotic disorder that is associated with many symptoms, including hallucinations and delusions.
Schizophrenia is a genetically transmitted disease, usually caused by certain types of genes or genetic mutations that affect brain development. However, it is still a partial mystery to how they are caused.
Schizophrenia has many symptoms and you probably won't experience them all. They're symptoms lots of people have mildly or occasionally, but with schizophrenia they're much more distressing.
The symptoms of schizophrenia can be divided into two types, positive and negative. These are not positive and negative like you might think. A positive symptom is not necessarily good, for example. In the case of schizophrenia and other psychological disorders, a positive symptom is one that adds a behavior, thought, or feeling, whereas a negative symptom takes away a behavior, thought, or feeling.
A hallucination happens when you hear, smell, feel, or see something that isn't really there. The most common type is hearing voices. These are usually rude, critical, or just plain irritating. A delusion is where you're completely sure of something which others see as mistaken or strange. Paranoid delusions are upsetting ideas that make you feel persecuted or harassed. You might start to see special meanings in ordinary events. It feels like things are specially connected to you or that someone is communicating with you in strange ways. You can feel that your thoughts aren't your own or that your body's being taken over. You lose interest in life. Your energy and emotions just drain away. You can struggle to concentrate and lose your normal thoughts, feelings and motivations. You can also feel uncomfortable with other people. If you're starting to get these symptoms, you should talk to your doctor and start medication as soon as possible. Medication can help the most disturbing symptoms. Most people get support from a community mental health team. This includes a psychiatrist who organises your medication and takes responsibility for your overall care, and a care coordinator who helps you make a care plan and ensures you get the right support. Support from friends and family, counselling and other services are also very important. People with schizophrenia can feel suicidal, particularly if they're not getting the right support. That's why it's really important to ask for help. Learn to recognise early signs that you're becoming unwell. Agree with someone you trust that they can tell you if you're becoming unwell again. Try to avoid things that make you worse, like arguments, stress, street drugs, or drinking too much alcohol. Learn ways to relax. Make sure you regularly do something you enjoy. Look after yourself by eating a healthy diet with lots of fresh fruit and vegetables. Get some regular exercise, even if it's just a short walk each day.
Actually, there are many different types of schizophrenia, all different in the behavioral symptoms and distinct characteristics. First, the most commonly occurring type of schizophrenia is paranoid schizophrenia. Patients of this subtype do not display major symptoms until at an older age, which makes it difficult for others to spot abnormality in the way they act. This subtype often triggers its patients to have delusional thoughts and images, especially about persecution and suspicion and others plotting against them, which may provoke forms of paranoia in the patients, such as hearing voices. The second subtype is disorganized schizophrenia, which largely affects the patient's thought process. This causes them to speak in a disorderly manner, using unsuited vocabulary and disarranging the words in a sentence, which makes their speech often difficult to understand. Also, when answering a question, their answer may be completely irrelevant or off-topic to the question asked. In some cases, patients with disorganized schizophrenia are unable to complete everyday tasks such as making a meal or getting dressed. The third subtype is catatonic schizophrenia. It often affects its patients to exhibit extreme measures of movement impairment. There are three major characteristics: catatonic excitement, catatonic stupor, and stereotypic movement. Catatonic excitement is when a patient undergoes sudden hyperactivity that causes them to imitate sounds or motions that they capture in the environment. These two are also known as echolalia and echopraxia. On the other hand, the patient may show a sudden decrease in movement to a point where they seem frozen in place. This is called catatonic stupor. Lastly, stereotypic movement is visualized when the patient would continuously repeat assumingly purposeless actions without
Finally,
realizing residual schizophrenia is when a formal patient is no longer exhibiting extreme conditions. Usually, patients are able to return as a capable individual to society and in their daily lives.
1 in 5 people will recover completely. Most will get better, but have times when they get worse again. Many settle down, work, have good relationships and live full lives.